In this video, we're going to go over some of the landmarks of the hip bone. So let's take our right hip bone here, and we're going to turn it to look at the lateral side. When we do that, we see this very deep socket shape that's formed by ports of the ilium, ischium, and pubis. This is called the acetabulum. Acetum means vinegar, and the ending on acetabulum essentially means small cup. So acetabulum means small vinegar cup. Roman soldiers, when they were on campaign, would have small cups they would use to measure out vinegar to add to their water. That basically helped keep off thirst, or at least supposedly. Those cups were called acetabulae, which is where we get the word acetabulum from. I know that's probably not super relevant in our modern lives, but that's what the name means. This is going to be where the head of the femur articulates to form our hip joint. Now, if we turn the bone inwards like this, we can see running along the ilium this ear-shaped surface here. This is called the auricular surface. And if we remember our sacrum, we remember that on the sacrum there is an ear-shaped surface. So the auricular surface of the sacrum and auricular surface of the hip bone fit together just like that to form a joint. Now our next structure, if we look at the top of the hip, running along the top of the ilium, we have this crest of bone. We call this the iliac crest. If you take your hands and you put it down on the sides of your hips, that big ridge of bone is the iliac crest. Now, if we go forward on the iliac crest, remember the pubis is in front, so we're going to go forward. We see this sharp spike of bone here at the very front of the iliac crest. This is the anterior because it's on front, superior because it's above this bump, it's on the ilium, so iliac, and it's sharp, so spine. Putting that all together, we call it the anterior superior iliac spine. If you put your hands on your hips and slide them forward, you should be able to feel two bumps at the front of your hip. That's your anterior superior iliac spine. If we go back to our iliac crest and we follow it back, we find a sharp piece of bone on the back. This is the posterior superior iliac spine. This posterior superior iliac spine is important because this is where we can come in to harvest bone marrow from a patient. Now, if we go from our posterior superior iliac spine and we travel down, we notice this very large notch in the back of the hip bone. Here's the front view, so you can see it is in the back. This very large notch in the back of the hip bone is called the sciatic notch. And the reason we call it the sciatic notch is the sciatic nerve travels out through this notch into the posterior thigh and runs down the back of the leg. Sciatic actually comes from a Latin word that means pain in the leg, because if the sciatic nerve gets irritated, you get pain in your buttocks, hip, and that pain shoots down into your leg region. Coming down from our greater sciatic notch, we have our ischial spine. Ischial refers to the ischium, this bone in the back, and bone region in the back, and spine means it's a sharp projection. We can also see on the ischium this large swollen area. This is called the ischial tuberosity. Tuber means bump or swelling. Osity means many. So it means many bumps or many swellings. Tuberosities tend to have a lot of small bumps over a large area. The ischial tuberosity is where we sit. On the front of our hip bone, we have this very large opening. This is called the Obturator Foramen. Obtur means to close over. And that's because in life, this is actually closed over with membranes and muscles. There's only a very small opening near the top where a few blood vessels and nerves travel out. It's mostly a way to lighten the hip. Where the two hip bones meet in the front, so this area right here, is called the pubic symphysis. Symphysis means grow together. So it's essentially where the two pubic bones or pubic regions meet in the middle.